So Ehlers-Danlos patients have loose connective tissue, and there's a lot of collagen in nerves, and I think their nerves are soft and the muscles are tight. And there's a universal problem for Ehlers-Danlos patients where the median nerve is pinched here, but there are no symptoms, but you get painless weakness of these two muscles, and the weakness is proportional to the joint laxity. So if a person doesn't have loose joints, they have a little bit of weakness that they easily adapt to. But if they're loose jointed, they have profound weakness, and the adaptations cause problems at the thumb and around the elbow. So if we put his hand like this, the muscles that bend these end joints are all the same size, same shape, same weight, same vectors, should have the same strength, but these two are supplied by the anterior interosseous nerve that gets pinched right here. If he makes a fist like this, pull your fingers down, pull down as hard as you can, that should be this strong. These are all normal, and this one should be the same. And these two are in the same chain. Pull your thumb down like that. You can't fake this weakness, and there's only one cause of it. But you can do this, now pull down, and it works fine. And pull your thumb down. So you get tension from contraction, but you also get tension from stretch. People who adapt to the weakness by doing this get sore, like right here. And people who adapt sideways, this gets sore, like this thumb is not supposed to do that. The hand should go with the thumb.
That's crazy.
This tendon is supposed to be here, and it's here. And when it goes sideways, it rubs on the joint and it gets sore. And this joint bends backwards, and you can move the tendon that pulls this up to here and move this tendon over and solve that problem. These tendons go sideways. And it aches when you do things, when it goes sideways like that, and the fingers will lock, and this gets mistaken for a trigger finger, but you can tie this tendon down so it doesn't go sideways. His wrist is mechanically unstable, so this is me dislocating his wrist with minimal pressure, and that tends to get sore, like right here when I do that. And there's a little bone here inside the tendon called a pisiform, and it's supposed to be attached to the hamate. And this isn't really attached. And when you move the wrist up and side to side, this bone goes sideways instead of staying where it's supposed to. And then it gets sore here. And this aches. And then people drop their shoulder, and the nerves going into the arm at the shoulder level get pulled on. And you get an ache that goes up the arm. And make a fist for me. There's a tight band here that pushes the muscle into the nerve. And you don't need this band. You can just cut it. And the nerve feels better in the recovery room.
Can't wait. Can't freaking wait.